Thanks. H1N1 remains at the forefront of a lot of
Beautiful.
people's minds with another local child's death that could be linked to the virus. But how do you talk to your kids about the flu without them freaking out? Joining me this morning from Butler Hospital is child psychiatrist Gerald Tarnoff. Thanks for being here this morning. And I think this is a really important topic because particularly in two schools, in Lincoln and also in Portsmouth, we've had two students pass away. We haven't confirmed a link that the cause of death was H1N1, but certainly people are on high alert and the students are on high alert. So how do you inform them of how to stay healthy without scaring them?
Yeah, that's a good balance to try to get.
Yeah.
There's 4 points that I wanted to make. The first thing is really to have an open conversation with your children. Have an attitude of acceptance, of support and encouragement for them to be able to talk about whatever their concerns and fears are. It's nice if there's two parents available to have both parents there. If there are other available caretakers like grandparents that they're close to have it as a family discussion. So I think that's the first point. Have an open encouragement and support from what they say. Don't force them to talk about things they don't want to talk about.
Okay. Second
thing is to really be responsive, to try to have a good understanding of what their concerns are. Kids, especially younger kids, may not be able to really verbalize exactly what they're worried about.
Mm-hmm.
So a parent should try to have at least as good an understanding, listen to them, try to understand what they're worried about, and then to respond to that. And then the response is more likely to be effective and helpful. The other thing is, of course, do it according to their developmental age.
Right.
A 6-year-old is certainly not going to ask the same kind of questions or have the same needs as a 16-year-old. The 6-year-old may want to mainly know that they're going to be safe and that their parents are going to be there to protect them and things like that. A 16-year-old would have more sophisticated
and the
types
last
of questions.
bit of advice that you wanted to...
Well, the other thing is, of course, be reassuring, but do it in an honest way. You don't want to give false reassurance because kids need to know that parents are honest with them. That's going to provide a lot of safety.
Just about 30 seconds left. I'm curious, when you tell kids to make sure they wash their hands, is that empowering to them? Does that help them have a tool to fight their fears? And also, what do you do if a kid doesn't want to go to school?
Well, the first one is very much so, I think. It really does kind of gives the kids some things to do that really have been accepted and recommended by the Department of Health and the CDC and everyone else. Mm-hmm. In terms of the other question, you have to make some decisions that so far nobody has recommended people not go to school as long as they're healthy. So I think we need to continue to do that and listen to kind of the advice that's given by pediatricians, by the Department of Health, by the newspapers, by, earlier this morning I heard on the station, prepare but don't panic.
Right.
I think that's a good message.
Well, thanks so much for being here this morning. And if you want more information on H1N1, we have complete coverage on our website, foxprovidence.com, including school vaccination schedules. Time now.